Dr. Veer Pushpak Gupta, doctor who's working in the UK at the National Health Service, joins us with his story. The doctor who was treating a COVID-19 patient and he himself was infected to be a positive case, and then he self-quarantined himself for 15 days treating. Thank you for joining us, Dr. Veer, on
Thank you.
this. My primary question to you is that tell me, how were you able to find out about the symptoms? What was the early detection, and were you sure that probably you have turned positive because you were treating many COVID-19 positives?
Yeah, so I'm in the acute medical unit in an NHS hospital, and around mid March, we started to see a huge influx of patients starting to come in. Patients that were probably traveling from different places and returning to Britain, and they were coming back to the hospitals, and they were having these symptoms, which showed very similar symptoms to what a COVID patient would have. But at that time, UK was not ready with their testing kits. They were not ready with protection equipment. So we were basically treating every patient that was coming in as a possible COVID-19. I saw a patient of mine who was admitted to the acute medical unit and needed a minor surgical procedure done. So I assisted with one of my surgical colleagues to do that at that point. And we did not know that that patient is positive. Later turned out to be positive, and that's possibly where I got my infection from. Because it was in the initial stages of the outbreak. Even the doctors were not prepared. The hospitals were not that prepared. So, that's where I feel that I got it from. And I almost immediately knew that I had gotten it because I was working on a respiratory ward. So I was pretty high risk to begin with. I also have asthma, so again, I'm high risk to get an infection. And so when I went home that day, I started to develop high fevers, started to develop a dry cough, and then I was admitted to the emergency department in my own hospital about 2 days later with shortness of breath. And when they tested me and when they did the tests, it was a very likely COVID-19 picture with all the blood tests and the X-rays. And then obviously later on, it was found to be that it was COVID-19. So I had two admissions, and then I was discharged. I wasn't admitted to the ICU because my symptoms did not exacerbate enough that I needed any sort of ventilator support. But I self quarantined, medicated myself with whatever I had at home, and yeah, just waited it out basically. And this is a story with many other doctors, and not only in the UK but the US, all around the world, where we are being infected. Some of them, end up in the ICU. Some of them don't. Some of them die. 54 doctors have died in the United Kingdom. Most of them are of Asian and Black descent. So when I say Asian, I mean subcontinent, Indian, Pakistanis, Arabs as well. They come under Asian and Black people. So there is some sort of predisposition that we are seeing in the UK to healthcare workers of Indian, Arab, and Black descent, where they're needing more ICU admission than others.
Right. Dr. Veer, I'm going to relate a very important question to your answer, and that is about the social stigma that the quarantine and being infected has created. At least if we speak about cases on record in India, ostracizing and harassment has been one major key concern that most doctors, nurses in India have been facing. I do not know about UK, but in India, of course, there have been certain cases where nurses who've been infected have faced this kind of behavior from members around families, societies, RWAs, and rest. Tell me, with the social stigma factor, did you have to face any kind of, such ostracizing or stress from people around?
Not at all. Not at all. In fact, the opposite. I mean, people are treating us like heroes over here. Every Thursday at 8 p.m., they come out of their homes, they clap for us. The entire London shuts down. There are TV cameras everywhere. You might have seen the videos on Sky News, BBC, where people are out and showing their appreciation for what healthcare workers are doing. And I think it's the same case in most places. A minority of people in some countries can be dismissive towards people that are in the front line There have been isolated attacks in the West, but I have heard stories from India, and it's very disheartening to see these kind of stories coming out from India where doctors are being attacked by mobs, they're being evicted from their homes, they are being told they're being refused burial. I mean, these are just basic human rights. More than that, these guys are putting their life at risk. They're putting their family's life at risk and going and doing their job. I mean, the least India can do as a society, and when I say India, I mean all of us, can be to respect them and to give them some sort of honor and some sort of grace in what they're doing, and encourage them to do this, because they're the only ones who can. Imagine if they say that tomorrow they don't want to go to work, and they refuse because of their own safety or because of what's happening. Then who's going to keep these number of cases at check? Who's going to treat these patients? So it's bizarre to me that people are doing that, and I think that they should be a little bit more respectful. The stigma thing that you talked about, I have talked about it before in certain places, and I feel that instead of any disease that comes out has a stigma to it if it affects a large number of people. I think that we should go away from the stigma. Yes, there's a contact precaution that we need to take, but if you know someone that's infected, please help them. Help them with groceries, help them with food, even if you leave it outside their door. But we have to work as a society at this point rather than thinking individually.
Right. Dr. Veer, just adding on the stigma part, there's also this kind of perspective that's come out that, the testing of middle class has been very, on low numbers. People are not willing to get tested because of this whole factor of social stigma. What if they turn out to be positive, and what if they're going to be judged in the society that they're living?
Well, again, this is something that needs to go away. This kind of stigma is both wrong, and it will lead to an increase in cases, an increase in numbers, because the whole point of testing is that once you get tested, you're socially isolated. The whole point of social isolation is so that you don't infect others. Contact tracing. The countries that have tested, have done proper contact tracing, have been able to defeat this virus. So I think it's the responsibility of the public health bodies and the government to spread the awareness that there is no need for social stigma. We need to spread education on this rather than fear. And there's no need for social stigma. It is an illness like any other, but we need to take precaution until we have a treatment. And treatments are in the works. They will be out soon, but until then, isolation, lockdown rules are very important. So look away from the stigma and let's look at the facts of this disease, and let's not categorize people. We are very fast in categorizing people, I think. And I think that we should stay away from it if we want to defeat this disease. Yeah.
Right. India has, of course, extended its lockdown by next 2 weeks. That's happened yesterday after MHA has released. And this is probably more of a partial lockdown because a lot of relaxations have been given in certain districts that do not have any COVID-19 cases. Now, what I'm asking you is this whole concept of asymptomatic patients that's coming in. I mean, the ones who do not have symptoms, or the ones who are called outliers in terms of turning positive after the 14-day quarantine period. In such a case, do you think the testing number of times a patient has to be tested, should this be modified? What is this? Is asymptomatic patient something to be very worried about? Because in this case, we wouldn't know that who is positive and who is not.
That's correct. So there's a few things here that you've asked about. One of them is that with any viral illness or any sort of contactable disease, there is an incubation period. And the incubation period basically means how long a patient does not show symptoms for, but is also infective at that point.
Right.
Okay. And so looking at those incubation periods, most public health bodies around the world put it as 7 to 14 days for COVID-19. That within 7, if you're showing symptoms, the minimum you need to isolate for is at least 7 days. The maximum can be up to 28 days. But if you're not showing symptoms, then you have a positive contact with another patient, then you should at least isolate for 14 days minimum. So those were the recommendations that have been given by the WHO, by Public Health England, and other public bodies around the world. Even India follows that. Asymptomatic patients are concerned, and that's the entire basis of a lockdown, is that you might be sitting next to someone that is not symptomatic, but that person might still give you the virus. So, some countries have been very good at contact tracing. They've been able to, Singapore, for instance, is very good at contact tracing. They find out that one person had the virus. They find out who that person was in contact with. They send a message to that person saying you were in contact with a person that had the virus. And so that person has to isolate as well. So contact tracing is very difficult in a country like India. As you can imagine, population, logistics, there's a whole range of issues with that. So, we're not going to be able to do it very effectively in India. So we have to use other measures. And that's the reason lockdown rules are there. That's the reason I'm guessing lockdown has been extended. I also want to just really quickly touch upon the fact that the numbers in India might not actually be the real numbers that you're seeing. And there are several reasons for that. The number of deaths that are being reported in India. First of all, testing is not at the level where we are testing everybody. We know that. We're testing a very small percentage of the population. The second thing is that only 20% of deaths in India are reported by a medical examiner. 80% of deaths in India happen at home. So the people that are dying at home they could be dying of COVID, they could be dying of something else, but we don't know what they have died of. So the reporting is only 20%. The scary thing about this is that India has only 57,000 ventilator beds in total, ICU beds. This is from a simple search on Google that I have been able to find out that 60,000 ventilator beds across the country for a nation of 1.3 billion. And even if 10% of your patients end up in the ICU, we have a chance of overwhelming those beds very, very fast. So the lockdown was a good thing. It was a necessary evil. And the fact that it's been extended, in my opinion, is a good thing, at least in the high density areas.
Right. The Ministry of Health has been continuously persistently giving press conferences on this. And when it comes to the part of testing, they say that they are testing accurately in terms of, the communities or the containment zones that need testing. But somewhere, do you think the problem with us under testing in India is also because of the number of kits and the lack of PPE that we have?
Yes, absolutely. This is not just a problem in India, this is a universal issue. The UK has been very slow in acquiring these kits, has been very slow in acquiring protection equipment. That's why a lot of doctors are dying here. The same goes with the United States. There is an international shortage of these kits. Also, testing is being developed very, very fast. So different types of tests are being available. So we initially had what we call serology testing, which was taking 5 to 7 days. Now we have antibody testing, which is much faster. We have kits that are coming out, which are 45-minute testing kits. But it will take time for these kits to be produced, to be spread across the world, and especially in a country of 1.3 billion people, it will take time for the government to acquire them. So yeah, absolutely. It's a logistical problem more than a production issue.
And how longer do you see this continuing, keeping in mind that we do not have yet any, answer on the vaccine coming out, though, of course, countries have been trying, and WHO has been mentioning this, that the efforts are on. But how long do you see this panning out? I mean, can lockdown be the only solution?
Well, Karishma, the vaccine trials have begun in the UK now. 500 volunteers were the first 500 people to be, examined with the vaccine and to see whether the vaccine works on them or not. The problem is that vaccines like this take years to develop, and they take clinical trials with thousands and thousands of people to see what kind of reactions they can do in people. We don't have that much time with this kind of virus that spreads so quickly. So I suspect that it will still take about a year to a year and a half until vaccines are available to the general masses. We have two problems at the moment, an immediate problem and a long-term problem. The immediate problem is that when the lockdowns need to be lifted because of economic issues, because of jobs and money issues, finance issues. So the lockdowns will be lifted. But then we may have a second and third wave of cases that we'll have to deal with, and so yes, we'll be better prepared as medical professionals and as governments, but we still will have a surge of cases once the lockdowns are lifted. The longer term issues are, again, to do with vaccines, to do with development of drugs, to do with spread of these vaccines, to do with general population getting these medications. So certain antiviral drugs just recently in the US have been proven to be effective in decreasing the ICU stay. So all this is work in motion, in progress, and it will take some time. My guess is about a year until we have proper treatments that can be given to the general public.
Right. Dr. Veer, before we let you go, one last question. Maybe tell us a bit about your experience with the 15-day quarantine period. It's something not very happy to talk about, I know, but maybe it could help a lot of other people who are being very cautious about the fact that, what probably happens once you are infected. What are the kind of changes that you notice? Maybe people and viewers should know about it.
Yeah, so 70% of the people will have a mild version of this disease, general cough, fever. About 20% of them will progress to an admission to the hospital. So shortness of breath, which is what I experienced on a few occasions. It was difficult for me to even complete sentences at some points. I was coughing so much that I couldn't even talk to my own family on the phone. And that's where it gets difficult. When do you know whether you're going to deteriorate or not? Because you deteriorate quite fast in this illness, as I've seen in patients in my hospitals. So shortness of breath is the main issue that people face. And that leads to admissions, that leads to oxygen requirements, and that leads to further escalation of care. So my 15-day period, I was just basically monitoring myself to make sure that I don't reach that point. And if I did feel that I was at that point, I was going into the hospital and getting myself checked up. So yeah, it was a difficult experience, and I don't want to relive it again. But family and friends helped a lot with everything, so I was very lucky. But whoever is going through this experience, you have to understand that that person will need a lot of help and a lot of encouragement and support. So I encourage that people get rid of the stigma and try and help those people that are infected.
We're good to see you back in action. For that,
Thank you.
thank you so much for joining us, Dr. Veer. Thank you for talking to us.
Thank you very much. Appreciate it. Thank you.